Hi, my name is Greg Kowal. I'm the Head of Architecture working for Ramsay Health Care UK. So some of the challenges that we have specifically within a healthcare setting are a lot of disparate systems now, and underpinning that is the need for regulatory compliance, meeting with government bodies as well as industry regulators to make sure that because we are managing effectively patient data, sensitive healthcare data, there's a lot more scrutiny that's put on us as a healthcare provider to make sure that we are safeguarding that data appropriately. Clearly, there's a larger drive or initiative around AI today, and because of that, we have to place a lot more scrutiny on the services that we start to consume going forward. So I'm sure alongside a lot of other companies, we also have to have a AI policy in place. We've got governance around artificial intelligence. We scrutinize any partners that we have working with us, as well as any service providers that we use, public or private, in terms of making sure that they are putting the adequate controls of that data, making sure that, again, it doesn't contravene any of the existing controls that we have. I mean, it's fair to say that healthcare isn't exactly at the cutting edge of a lot of technological advancement, and that's simply down to the fact that there are a lot of systems out there that you've got to maintain historical data of patients for an extended period of time. So it's not always easy to migrate and transition that data into new modern platforms. So you are always inherently just carrying a lot of technical debt. Where we've asked Transparency for help and assistance is to modernize some of the applications that we've got. So case in point, we've got a couple of key applications. One is around our scheduling and booking of appointments for patients. So that was modernized and transitioned into a cloud setting and delivered in a more modern way rather than your traditional, I'll stick a server in a data center. And another one was around the sterilization of medical equipment. That particular application was also modernized and transitioned into a cloud setting, also set up for high availability, disaster recovery, augmenting our business continuity. We work together with the team of Transparency to make sure that we could deliver a solution that makes sense to us as technologists and also delivers business value back into the business from a financial spend and accountability perspective.